Hello, good evening. How are you doing? Welcome to another session of Ask the Doctors. My name is Dr. Frederick Unubohai. I'm a licensed medical doctor. That is, I go medical school and I have a medical license. So I'm a qualified medical doctor. People call me Dr. Fredo Star, and I always tell you good life in that sense. Now, this program holds every Sunday by 8 p.m. to 9 p.m. Nigerian time. And if this is your first time seeing me, you are welcome to this page. Here we teach, we explain, we don't treat on the internet. I don't treat on social media. We don't prescribe medications on social media. If you have any questions, we'll try to explain to you. Now, today's program is a question and answer session. So if you have any question for me and my co-host, Dr. Israel, we will answer you today. Welcome. Where are you watching me from? Tell me, where are you watching me from? I want to give a shout out. Please, I beg, in case you're watching this video after we have ended, I might not be able to respond to you. Apologies. No vex. Biko, jaw, whoa, whoa. Hmm? Yes. So tell me, where are you watching me from? Today's program is a question and answer session. I'm live on Facebook, my two Facebook pages. I'm also live on YouTube. My TikTok audience are watching me on TikTok, though I might end the live session on TikTok very soon because you might not be able to hear my co-host. Yes, Blanche is watching from the United States. Theodora Princewill is watching me on YouTube. Chudo Hyacinth, how you there? Good evening, everybody. Welcome, welcome, welcome. Now, without wasting your time, I beg, share this video, share this live session. If you have any question for me, drop your question in the comment section and I'll start responding to you. I'm only going to take questions on Facebook and YouTube. Hmm? I'm only going to take questions on Facebook and YouTube. Do you understand, Abeg? Share this live. What again? What again? What do you want to say again? If you want to join my Telegram, yes, I have a private Telegram channel. You can subscribe to join my private community. Huh? Yeah, let's go. How you day? I don't know why they speak grammar, why they speak Oyibo. Now pidgin at the talk, I beg. I know they do any grammar thing. You understand? Yeah? Yeah, man. Watching from Nigeria, Steve Fidelis is watching me on YouTube. Where in Nigeria are you watching me from? I beg, send your questions right away. Send your questions. No worry, I'll go answer you. Send. Okay, let me see. Good evening. Please, if you are watching me on TikTok, you want to ask me a question, please move over to YouTube and Facebook. I'll definitely answer you. I'll promise I'll answer you. Okay, you're watching from Anambra. Okay, Oluchi on YouTube. Oluchi, how far now? Watching from Scotland, United Kingdom. Oh she, Omo, is well. One day, I will travel around the world. Please don't forget, you can send me stars. You can send me super chats, super stickers. If you are watching on YouTube, you can just recharge and send me super sticker, super chat. Say this guy, buy pure water. Send me something. If you are watching me on Facebook, send stars. You're born twins. Okay, let's go. Zainab, how are you? Now, please drop your questions. If you don't drop your questions, no problem. What do I have to say? I want to say something. I go follow you travel. Oh. No problem now. We'll be there together. What do I want to say? What do I want to say? Before I start taking your questions, I want to say something that has been on my mind. Good evening. Okay, I'm watching from Port Harcourt. Can someone with 24 day menstrual cycle ovulate? Yes, now Gladys. Gladys is asking me when can someone with 24-day menstrual cycle ovulate? Gladys, listen carefully. If I tell you the exact date, you will forget. You hear me so? If you get 24-day menstrual cycle, your ovulation now around day 10, but you no go understand how I take get to that day 10. day 10 of your cycle. So go to my page or go to my YouTube. I made a video, 28 minutes. That is the longest lecture I have made right now. Maybe I will have more right now since I've been on the internet. That video, if you watch them, you can understand. If you don't understand, then you can watch them again. Do you understand? Because I took my time and I broke that thing down for you to understand. So go to my YouTube or go to my Facebook page, look for the video, how to calculate your ovulation, how to know the length of your menstrual cycle, and many other things. Sit down there, watch them. Watch them. I put my hands on my chest because I know what I do for the video. You can understand. But if you don't understand, you go watch them again. Yeah? Uh-huh. Okay, so Dr. Israel is on the live session now. I'm going to bring him up. Dr. Israel, if you are ready, give me a thumbs up. I'm going to bring you up. Give me a thumbs up. Okay. Yeah, yeah. Dr. Israel, how are you doing? Good evening.
Good evening. Happy Sunday. And good evening to
Yes.
everybody.
Yeah, good evening. Welcome. Before you came just now, somebody be they asked me about ovulation, how to calculate. And I remember I said last week, 2 weeks ago, we explained about ovulation and many things. So we directed them to go watch the video. So I just say my highlight on them. So let's take more questions. Anybody will get questions, we're going to respond to you right now. We have a question. It says, please, doctor, I want to ask if a couple who has not had for a long time and they now decided to start having kids, would there be any problem to the children?
Okay, there will be no problem to the children. Anytime they decide say they want to start to get kids, children, so they can't decide to go knock. There's no problem. There's no problem. So far they knock at the right time so that knock at the right time so that the woman go figure belly and the baby will come. And that's just it. And then make sure say both the woman they really they see ovulation and the man sperm they very active, then everything will be in the same page. And it will be nice that for these people they can decide to go and see a gynecologist, which will guide them through so that it not go hard them.
Yeah, thank you so much, Dr. Israel. Before I take the next question, before I answer your question, everybody share this video. Share. Share this video quickly. If you know they share, I dey see the people where they share right now with my iPhone. I'm gonna be very, very selfish. If you no one help me, help us share. Okay. Somebody's asking, good evening. I'm watching from Abeokuta, Ogun State. My daughter has G6PD, okay, glucose 6 phosphate dehydrogenase deficiency, right? I just want to ask, what are the daily multi needs that we can be given? And please, can she eat egg? And in case of allergic reaction, what is the best drug to administer? Hmm.
Okay, unfortunately, I will not be able to answer this question. Reason because if you know say your pikin get G6PD deficiency, it not be you by yourself give that diagnosis. It must be that you get that diagnosis from an hospital. So if you get the diagnosis from an hospital, you need to meet that doctor when he give you the diagnosis to also give you the kind of medication you can give to your child if there's any allergic reaction. Because yes, the person may be allergic to some things. And also you may want to do some allergic tests for that child to know what is going to be allergic to. Uh, Apart from G6PD deficiency, may have other deficiencies. So the best thing I fit tell you is that go to that hospital where give you this diagnosis. However, if you not able see, maybe you not trust the diagnosis or you are not comfortable with the diagnosis, you can visit another hospital. A teaching hospital would be better. When they do all the investigations, still see the same thing. They will tell you everything that you really need to know and the medication that you can give to your child. Remember, we're not they give anybody medication for this platform, and we not they make diagnosis for this platform. All we do is just to try to educate you on one or two things that you need to know. But for this person, we have to answer this way because this diagnosis must have come from a medical personnel. And I believe, say, that medical personnel, if you really ask them all your questions, even before you ask them all your questions, they should have given you the best answers, that you know, can they ask us which medication you need to give your child if you get any reaction. Thank you.
Yeah, thank you so much, Dr. Israel, for that. It's not as if we don't want to answer you. That diagnosis is a very heavy one. And if they make that diagnosis for you, everything you need to know, the food to avoid, the medications to avoid, everything, the triggers, they will all list it down for you. This is bigger than this platform. You understand? Yes, yes. Okay. Please, what causes Theodora says, please, what causes cold feet? What causes cold feet?
Dr. Fred, answer.
Okay, so most times we don't have cold feet. But if you notice that you are having cold feet continuously, most especially when the weather is not cold, or maybe the weather is cold and your own cold feet is now extreme, that is, it dey too much. Normally, people just cover themselves and they are fine. But you notice that your own cold feet, you can't do too much. Be like they affect you. They give you pains and the other stuff. But if you cause some now things around your legs, you understand? Vascular issues, vascular like blood vessels, where your doctor will need to confirm, and other things. Maybe na nervous issue too. So they will need to confirm and do many things. So we can't be 100% sure and tell you that if they get cold feet, oh, now this thing they cause them. But one important advice we will give you be say, if you dey get this kind of condition, ensure that you dey protect your feet, and then you go need to see doctor, make them check you, examine you, because in some cases it can be very extreme and can be a sign of a very serious issue. While in some other cases, now just small things. So we can't differentiate if not the big one you get or not the small one you get. Is that okay? Okay. Well, if you are just coming, welcome. Before we take the next question, everybody share the live session. Share the live session. Share the live session quickly. If you don't share, tell me say I don't share. Um. Oh yeah. Oh yeah. Oh yeah. Oh yeah. Oh yeah. Okay, somebody's asking us a question here. Patricia is saying, please, can you please talk about blighted ovum? I want to avoid it by all means, because make I just respond quickly. So blighted ovum, what mean your name, Patricia? It means say the egg fertilize, but the thing no can continue. The belle, the pregnancy, as it fertilize, no can continue, can't form pikin. Your body can't come out normal. In most cases, na what we they call chromosomal problem, genetic problem, no be your fault. Now some things for inside your gene, you understand, your chromosome. So for every human being body, you get some kind of things where they happen where you don't even know, say they go on inside your gene. In some cases, it can happen like that. If you can't form this kind of thing, your body go come out. In some other cases, it will be due to, in some few cases, it will be due to quality of the egg or quality of the sperm. That one there among. And which other thing again? I can't remember. I can't remember other ones. Honestly, I don't know. Israel, if you have anyone again.
Okay, it can still be depend on the medications that you were on during that period, and can actually still affect the ovum and the sperm when fertilize the ovum. So if anything like that happened and the body tried to remove it, just to protect you, that's what the body is trying to do. And so the only way when you
Mm.
now the ones when you go feel avoid, now you go avoid like the medication. So sometimes when your age don't see the go, it means say sometimes the eggs will not be so active as it used to be. So some persons will likely start having such things. So that's why we say women need to they take some medication, folic acid and all that, if they are getting prepared to become pregnant. So that will still help them to some extent.
Yes, you understand. And I will advise you, if you know, say you get blighted ovum, speak with your doctor. Make them check you, make them advise you on what to do. It's not enough to just say, what can I do? You need to discuss with your doctor. You must discuss with your doctor. So that it won't look like we'll just leave you here. Good evening. Please, how can I get rid of internal heat? Away.
Okay, the first thing is how old are you and what do you call internal heat? Some people when they feel heat, normal heat, when weather hot, inside their body they hot and it's normal. You just need to go pour water for body and you are okay. Then depends, as I also say, how old are you? If you don't dey near your menopause, some persons can be having that and it can just be signs of menopause. And so there's nothing you can do about that. You just wait make the menopause come. And some persons have grown it, the thing just come and go on its own. So you better know which of them, if now as the weather dey hot, now you dey feel am, or if e be say you don dey close to menopause, now you dey feel am, or if there are some medications wey you dey take. Some medication can actually give you such thing if you are on some chronic medication. When I mean chronic medication, medication wey you dey take for a very long time, you've been taking it and you are taking it, whether na doctor prescribe am for you or whether na you decide to prescribe am by yourself. So you also need to check all that. And you also need to know, I believe it may not be every time you dey get that internal heat. You also need to know what time, wetin dey happen before e come, so that you'll be able to check yourself and stop whatever you think you dey do before that internal heat dey come. So internal heat in quote, not be diagnosis, not be one disease, may just be a sign to tell you say maybe something is about to happen or your body system is about to change. Dr. Fred.
Yeah. Thank you very much. Let's see. Okay. Good evening, sir, from Nigeria. Is it normal for a woman to be seeing spot of blood for 5 days after menstruation, Abby? Is it menstruation wanted to ask? Spots of blood for 5 days after menstruation.
So if you dey see spot of blood for, if it's menstruation, then another 5 days spot of blood, you know say menstruation never stop. Menstruation only stop when you are not seeing you are not bleeding again, and that may be there might be reason. It may be that either the person is on family planning, because some people when they're on family planning they can actually get that, or they have some other issues with their uterine system and their reproductive system. Let me just use the word reproductive system. So a normal menstruation is 2 to 7 days. So if you don't pass 7 days, it figure be one problem nine you get. It's only in some cases when you say maybe you don't see the menses after a long after some days, you can't see those kind spots of blood. Then you also know say it can down and still another problem of its own. So when you notice anything bleeding outside your normal menstruation, you need to see a gynecologist because you never can tell. It can be a malignancy, it can be something will not be a malignancy. So you need to visit your gynecology so that they will do some investigation for you, some tests for you, and then find out what is really happening. It can just be an hormonal imbalance issue and all that. So you'll be able to clear off and treat yourself as it should be.
Okay, thank you, Dr. Israel. The people are not sharing this live session and they are asking questions. I'm trying to look for the names of all the people that have shared so that make I find their question, answer them. You understand? Uh-huh. I won't find the names of the people we share. but it dey delay to open. And they come. What can make someone have scanty period after fibroid surgery? And it's been up to 2 years now.
Okay, the first thing is, how was your period even before the fibroid? Before you noticed that you have fibroid and you did the surgery and all that. Sometimes the kind of procedure that is used to do the surgery can actually cause that. Also, if there's something after the fibroid, one of the fear complication after fibroid is herniation and formation of herniation, which can call is it Asherman syndrome? Yeah, Asherman syndrome, which can cause Asherman syndrome. And that is like the additions come dey close the uterus to the extent say blood no go fit menses or even anything no fit enter well or no fit comot. So some persons can actually have that. If they come dey get that additions, Asherman syndrome, they can be having scanty menses. Or two, if e just be say that was how your menses has always been right from time until the fibroid enter, when you got to do the operation. And three, if it's really they disturb you very well and it's still if it's they disturb you very well and you stay, maybe you are trying to become pregnant and you are still not pregnant, please go and speak with your gynecologist again, meet your doctor again. And I hope it was the gynecologist that did the surgery before. So meet your gynecologist again and speak with him or her, then they will know what to do to make sure say you see your menses very well. And also, it can also be an hormonal imbalance. It can also be an hormonal imbalance because after the removal of the fibroid, the body system will also try to regulate itself to get itself back and all that. So hormonal imbalance can also be part of it. So just know all these things, and any of them can just be the cause.
Thank you so much, Dr. Israel. Let's take more questions. Doc, good evening, sir. Abeg, if person wey get low sperm, how can person improve that?
Okay, if somebody with low sperm will need to speak with a urologist. Urologists, they are doctors that are specialized in that aspect of their body. You can visit them, you can see them. If you see them, they will know what to tell you to increase it. However, before you see them, you can do exercise. Exercise can help you. It may not just boost the sperm to come out well, but it can help you. Then there are some food you can eat, fruits and vegetables that you can be eating within the period. Something like banana, something like watermelon, cucumber. Yeah, those things will actually help. Tiger nuts, yeah, those things will, yogurt, those things will also help you try to and you need to take it for a long time. So sperm production is not something that because it's half, if you just take it for 2 days, the thing go all poof. No, that will not be so. You need to take it for a longer time before you go even see effect. Even when you even see these doctors and they give you any medication to improve it, you're still going to take those medication for a long time before you go see improvement. So that's one thing you should know about it. So try to see a urologist and just take those my advice when I talk. It may help you.
Okay. Let's see. Somebody's asking us about blighted ovum. I've answered you about blighted ovum. Oh. Good evening. Good evening, doctor. Please, there is this fleshy cramp that comes out on last days of my menstruation. Any cause for alarm? Cause I don't know what it is.
What is fleshy cramp? I don't understand your fleshy cramp. But if it's like you're seeing a clot of blood coming out at the last day of your menstruation, I don't think it simply means that maybe you're having a heavy flow. That is why. But I don't know if I understand that word fleshy cramp. Because cramp, fleshy, they are two different to me. They are two different words. Cramps like pain. Eh? So if it's like you're having pain at the end of your menses, after that it stop, and maybe now every time like that you dey notice, I don't think you should be afraid. Just try to see what came out after that cramp and If it's just like your meds is like as it used to be, I don't think you should worry them. You should worry about anything.
Doctor, what is the cause of kidney failure and what is the remedy?
Okay, kidney failure. There are different things that can cause kidney failure, and there are different type of kidney failure. There's acute kidney failure and there's chronic kidney failure. And yes, the acute kidney failure can actually lead to a chronic kidney failure. Now, one of the major cause of kidney failure is high blood pressure, hypertension. Hypertension can actually cause kidney failure. So when you're having high blood pressure, it can lead to chronic kidney failure. Even diabetes can lead to chronic kidney failure. Some medications, there are some medication you take can actually affect the kidney. Then if there's shortage of blood, the kidney can be affected. There are some infections that can affect the kidney. Any infection to the pyelonephritis, any infection to the kidney can actually cause either acute or chronic kidney failure. Reduced fluid in the body can also lead to kidney failure. That is dehydration can lead to kidney failure. And so many things, in fact, so many things can actually lead to kidney failure. But these few when I just mentioned, I think they are the most common one, some of the commonest cause of kidney failure. So what is the remedy? You don't need to see your doctor. You need to see your doctor to take care of you. And in fact, drinking can lead to kidney failure. Smoking also can lead to kidney failure. So your lifestyle can also lead to kidney failure. So if you drink and you smoke, you need to stop. Anything when you know say you do when not make sense, you need to stop. Everything, as we said, it should be in a moderate form. Try to take care of your hypertension. If you have IBP, try to take care of your sugar level so that it will be on the normal side. Take a lot of water so that it can help you to clean the kidney very well. Because some of us now they drink water, and that can cause the formation of kidney stone, which can actually cause problem for the kidney in future. So try to take a lot of water and all that. When you take a lot of water and you notice you are urinating often, it shows that your kidney is working very well. Then don't be taking medication that is not prescribed for you. And when doctor not write drug for you, you go to take am. Some of this medication can actually affect the kidney. It can actually affect the kidney. If you take them for a longer time, you may just be causing problem for yourself. So when you stop all those things, those are just some good remedy and to prevent kidney failure. Yeah, and when you notice that you don't get any problem with your kidney, please visit your doctor. A nephrologist will be a very good person to see.
Yeah, thank you so much, Dr. Israel, for that response. Okay, if you are just coming, you're welcome. We are taking questions and answers today. Please share this video, invite your friends, support us by sharing. Don't forget, you can send stars, you can send super chats, super stickers on YouTube, on Facebook, you can send stars. Yes, send it, and we appreciate you. Somebody's asking a question here. Say, please, the causes of chest infection, please. Dina Ninio. The causes of chest infection, madam, they are so broad. There are different types of infections, and these infections can affect the chest. Do you understand? We have bacterial, we have viral infection, we have fungal infections. They can affect the chest. We have different layers of the chest. We have the skin, we have the lungs around the chest. Even in the lungs, we have different parts of the lungs. We also have the heart. So there are different things in the chest. Do you understand? So when you say infections, please, causes of chest infection, your question has no head and tail. So you have to make your question specific so that we know what to address. There are so many types of infection. There's pneumonia, there's tuberculosis, there are so many other types of infections that people don't even know about. So you have to be specific so that we know how to respond to you. Okay. We have a question from somebody on YouTube. He says, how do I deal with panic attacks and It says, how do I deal with panic attacks and health anxiety? I always have hard time sleeping always. Feeling like you will unalive during your sleep. Okay, Israel, you want to respond to this?
Feeling what? Feeling will. Feeling.
Feeling like he will unalive, he will die during sleep.
Okay, we require during sleep. Okay.
Yeah.
Yeah, and in fact this a mental health issue, and panic attack is one of it's a type of anxiety disorder. It's a type of
Mm,
anxiety disorder. When we talk about panic attack, it means say you dey fear for something. And one thing when you dey fear for now be say now you just talk so say in dey feel say if he sleep, if he your pass there join the ancestors, or
mm,
if your pass go the other side of the world. So the first thing is to first of all be to assure yourself that that will not happen. And two, when you notice you like say you don't fear, you need to take a deep breath and take a deep breath. That's like a relaxation practice. You take a deep breath, breathe in, breathe out. You take a deep breath in. You can take it in and count 1, 2, 3 to whatever number you can count to, and breathe out again. With time, as you do that, you see your nerve relaxing, you see yourself relaxing, and then you get to know and know that nothing like that can happen. And you also need to be giving yourself positive affirmation. Tell yourself good thing that you really want about yourself. That I cannot die. Even when I sleep, I cannot die. When I sleep, I will see tomorrow, because tomorrow is have greater things for me. Give yourself those kind of encouraging words. So when you are giving yourself those kind of encouraging words, and it will help to fight against those negative thoughts that you are having, those negative thoughts that you will buy if you sleep, and those negative thoughts that is running all over your brain, because as at that time your body will start trying to work with the positive affirmation that you are giving yourself. And as you do your breath exercise, it also helps to relax. But as you are doing this, it is also very important that you speak with a psychologist. To speak with a psychologist. So because there are other levels that they will take you through. There are other things they will tell you to do as well that can actually put you at ease. And if they see that it's too much, they can decide to give you some medication. Those medication will also be of help to you. So a psychologist and slash a psychiatrist will be a very good person for you to see. Thank you. Dr. Fred.
Yeah, thank you so much, Dr. Israel, for that detailed response. If you are just coming, you are welcome. We have so many questions, I'm sorry, so we're trying to take all the questions that we have here. Okay, let me go to the next one. Please share this live session. Share. Let's see. Okay, good evening. How can my father control HB? Which one is HB? Is it hepatitis or high blood pressure? Please, your question is not clear. Also, Israel, do you have an idea of what this person is asking us?
I don't know. HB. No. You should
Okay.
try and let us know what
Good
is
evening.
HB. Hmm?
Good evening. I want to ask you, but come, wait, before you ask me, you should share now. Oh God, I beg. Now one for these people here this night. I want to ask you, can someone who is above 50 years still be strong in bed? Okay, as long as this person is fit, physically fit, I'm hoping I understand what you mean by the word strong in bed. We don't have time. As long as this person has no complaint, no medical condition, or the medical condition is being managed well properly, person is fit, the blood pressure is fine, the blood sugar is within normal range, and every other thing, person is okay, is good to go. However, you cannot compare the age of a 50-year-old to a 40-year-old to a 30-year-old. So, for anybody who is in that age, the advice would be that if you want to perform, on bed. You just have to be careful and do within your limits. But yes, as long as you lived a healthy life and you are fit, you are good to go. Okay. How can I improve immune system? To improve your immune system, I'll just give you a few tips. The video is on the page. Eat well, eat healthy, avoid smoking, avoid alcohol, avoid all those artificial drinks. Hmm? Take fruits, take vegetable, exercise. These are things that will help your immune system. Avoid chronic stress. Take time off, take a break. Sleep is important. Sleep can also affect your immune system. Get yourself vaccinated for things like hepatitis, the human papilloma virus vaccine. If you're a woman, a man or a woman, you can get yourself hepatitis B vaccine. Get yourself tested before you take the vaccine. These are the basic things that would help your immune system. These are the basic stuffs. Then, if you have a problem with your immune system, you have done all this and yet your immune system is still low, then we might now need to carry out certain tests to know why you have a problem with your immune system. But these are the basic stuffs that would help your immune system. Dr. Israel, welcome. Theodora, we have answered your question now.
Thank you.
Theodora William West, we answered your question concerning cold feet. I answered you. Eh? Please, we cannot be repeating questions because we have a lot of people watching us. So we are moving with speed. No vex, yeah? Let's take a question here. Good evening. Is it possible to get pregnant when you don't meet your man ovulation day? After 3 days, you meet your man. Is it possible to get pregnant? So, Israel, please, you want to respond to this?
Okay, if you not meet your man on your ovulation day, maybe on your ovulation day, then you didn't meet your man, then 3 days later, that's when you meet your man. There's no possibility of getting pregnancy, of becoming pregnant. Sorry, see my English. There's no possibility to say you go get belly, as at that time. And because we talk and say ovulation within 24 hours, and the egg they stay for another 24 hours. So what do you mean be say if it's supposed to be the next day, at least the next day before now you meet your man. Or just talk. Yes, at least the next day now you meet your man. So if you don't pass the ovulation day, then 3 days you don't pass. Even though you meet your man, nothing will happen. Nothing will happen. You will not be pregnant because then you'd already passed the ovulation, the egg don't go, everything. Your body don't start another level. Now your body don't dey prepare for menstruation. And now it can be. So you will not be pregnant. However, if maybe you meet your man a day before your ovulation, eh, or even 2 days before your ovulation, there's every tendency. And not say you must, but there's every tendency say you feel become pregnant in the sense that the because of the fertile period, because of the fertile mucus when it did that time, and the preparation period for your egg when your body don't prepare, wait, that preparation period, that preparation fluid, mucus when the body they bring come out, it still dey help the sperm. So it will make the sperm to stay for up to 5 days. However, studies still show say na the first 3 days when the when the sperm go dey very viable, na the sperm go fit give belle. The last 2 days may not be able to do anything. So if maybe 2 days to your ovulation you meet your man, there's every possibility say you fit get pregnant. But if you come be saying you don ovulate 3 days later, sorry, nothing go happen. But we not be God. Anything is possible.
Yes, please, I emphasize again, ovulation is not 72 hours. Ovulation is 1 day. If you ovulate today, 24 hours after ovulation, because somebody was dropping a comment after you were responding. So I just say make, but right now she understands. Good evening. Please, I'm having serious chest pain. What will be the cause? What will be your name?
If they
Chukwuebuka.
get chest pain, go hospital. As they get serious, as you said, serious chest pain, please go to the hospital.
Yeah, go to the hospital. Serious chest pain. Enter hospital. We cannot start guessing with anybody here. Hmm? Okay, we have a question here. Before we take this question from Mr. Jamil Adewale, before we take Mr. Jamil's question, if you are watching me on Facebook, share. If you are watching me on YouTube, like, share, invite your friend. If you are watching on Facebook, like. That is a way to support us. Can you see? We know they do adverts. We never get advert or sponsor. So the more you share, the more you support us. But if you know they share, it simply means that make we know they do this what they do. So support us by sharing. Yes. My doctor, what are the symptoms of heart failure?
Okay. The one we said heart failure, there are different types. We have the right-sided heart failure, we have the left-sided heart failure, then we now have what do you call it? CCF.
Congestive cardiac failure.
Congestive heart failure. So when we say congestive, it means say the two sides don't they fail. So the commonest symptoms when
Symptom.
people they quick get one, and they go notice that their leg they swell. There are two legs they swell, and start from the down. You see your leg, we call it edema. When you get edema for your leg they swell. Down and one. Two, some not go they feel breathe well. They breathe well, get cough. And another one is that if they waka small, they will tire. Any little waka, they go tire. And another one is that they can't breathe heavily. They breathe heavily. Another one is that if they lie down for bed flat, without pillow, you'll be like say they want kpai. So they go need to jump, get up like that. They gasp for breath. They need breath. And even in the night, if they still sleep like that, if they not sleep for where breeze go, they enter their body without they not go fit sleep. Sometimes if they won't even sleep with pillow, you get where you go reach, they go need to put up to 4-5 pillows before they go fit sleep. In some cases, if that thing don't too worse, when they know they feel breathe, they not go even fit talk. If they talk, they not fit complete one full sentence at all. You understand? Sometimes that breathing fit make them they sweat well, or they sweat all them because na stressful activity. And you go just notice am for their belly and their chest, how the thing they raise, they go up, they raise, they come down. So when you don't notice all these are symptoms, and these are things when you feel sick. These are things when you feel sick. If both of the one when you don't feel sick, their blood pressure fit they go down. You not go high. Most of heart failure, their blood pressure not they high, their blood pressure they come down. Or if you check their pulse figure they tiny and all that. So when okay, these are the symptoms when you go feel see when it comes to heart failure. Yeah.
Okay, we are trying to move very fast because of time. No vex. What is the cost of kidney tests, Mr. Abdul Ibrahim? I don't know the amount. Dr. Israel, do you have the amount? Do you have an idea?
It depends on the kidney test that you want to do. At least nothing less than from 5,000 go up. You may likely do one of the tests.
5 to 10,000 thereabouts, yeah.
Yeah.
Yeah, 5 to 10,000. Okay, let's take this question. Good evening, please, doctor. Painkillers. We are told causes kidney failure. How do I deal with chronic arthritis? This is from Olivia Ngum.
Okay. Now we know say painkillers. Some painkillers can actually affect the kidney. Yes, that's if you have taken it for a longer time. Now, it doesn't mean that it must affect the kidney. Now, when we talk about side effect of medication, side effect of medication does not actually mean that it must affect. That side effect must happen to you. It's not a compulsory thing. And everybody gets his own how body till they react to medication. So if you have, even when you take all this medication, sometimes we take it with a lot of water and all that. So if you take some painkillers with a lot of water, it may never affect your kidney. However, other ways when you can comfortably take care of chronic arthritis is to make sure that it's not every time you need to swallow medication. And it's not every time you need to swallow medication. If the pain is not really paining you, that you can manage with it, why taking medication? You leave your medication and manage. Another thing, you can get a knee, if na your knee, the thing there, you can get a knee guard. And there's one thing that you can wear in your knee and it can help you. You can decide to use some balm to massage the leg. It can also help to reduce the pain. And lastly, you need to see your orthopedics, your doctor when they specialize in bone. So all those ones can actually do some x-ray for the leg, see some things for the leg that if na wetin they go remove something, remove am. If na, they can actually still give you some other pain relief that are kidney friendly, and so that you no go think of having, you no go dey think say you fit get problem with your kidney. So these are just some few things I think you can do.
Yeah, thank you so much. Okay. Doctor, how can one deal with stubborn staphylococcus infection? I would advise you, I would advise you to see your doctor. Number one, see your doctor. Speak with your doctor. Hmm? Most people, let me say this. For somebody asking us about staphylococcus infection, please let's clarify something. Staphylococcus is not a sexually transmitted disease. I was told that a man chased his wife away. He pursued his wife because the wife go do test and the result came back say she gets staphylococcus. He said the wife don't go cheat. This is a true life. I'm telling you true life matter. You pursue the wife. So before you can confidently say, na staphylococcus be your problem, it means that you have gone to see your doctor, a licensed medical doctor, not just anybody that has a doctor in front of their name, a licensed medical doctor. They don't contest, you can't confirm. If true, you get staph, they go treat you. But wetin we don't realize be say our people go just wake up, carry their body, go do test. And most times the method and the process wey they carry out this test, e dey contaminated with staphylococcus because staphylococcus they live with you. If you touch my nose, you come out and go test, you go see staph there. That does not mean I have staph, you understand? But in certain cases, some people can actually be infected. If indeed, though, say you get staphylococcus, see your doctor, they will treat you. And then after they treat you, go back again for follow up. But I beg, staphylococcus no be sexually transmitted disease, and make we stop to dey make am look like na one big disease wey don finish humanity. Pastor Israel, you get anything to add quickly because of time?
No, not really.
Okay. We are almost out of time now. Somebody, you are just coming and you say we should answer your question. Relax now. We have questions before you. Relax, I beg. You just enter. Okay, person says, please, doctor, what is the cause of lymph node? Oh, this question you get as a deal.
Okay, lymph node not be disease. Lymph node now part of the body immune system. They are part of the body fighters. When they the body, and we get them for every different parts, different strategic part of the body. If you can remember, I guess sometimes when you go injure for leg, you can't notice say close to your waist, something go come swell for there, come dey pain you. That thing when it swell for there na lymph nodes, na swell for there. Why e swell? They try to make sure say any disease when that injury when you get for leg suppose carry enter every other part of your body, e go trap them so that make them not fit enter any other part of your body. So lymph node not be disease. Lymph node is just is a lymphatic system. They help to capture diseases, they help to capture infections so that make it not spread to other part of our body. However, in some cases, mostly for children, mostly for children, the tonsils, all those, they can get inflamed because of the so many diseases when they don't fight. Then they self can fall sick. So when they fall sick, you treat them. And when you treat them, they get better. And that's it. So lymph node not be disease, now part of your body defense system.
Okay, you heard Dr. Israel clearly. we are almost out of time. Let's take one more question here. He says, Doctor, I notice having some bumps, especially when I shave or especially after menstruating. When I press it, there's usually is this pus and hair coming out of it. So, Israel, want to respond to this?
And Dr. Fred, answer. No, I don't
Okay,
want to.
okay. Bumps after you shave. So, if you notice that whenever you shave, you they get bumps. Number one, how you they shave? Not be everybody supposed to dey shave go down. Some people not just to cut the hair a little bit because the texture of your hair can be very strong. So that when you shave like this, as the hair they grow back, if it give you problem. So you need to know the kind of hair where you get, number one, and how you shave. Number two, the angle where you they shave matters a lot. If your hair they face front, you can't they shave go back, there's a high chance you will give yourself bumps. So you need to shave in the direction that your hair is growing. You understand? Number three, there are certain things people now rub that can help them make their hair a little bit soft, easier to shave. The next thing again is if you notice that after menstruation, you dey get pulse when you press them, that one is abnormal. Normally, menstruation no be sickness. Menstruation is a normal process in every woman wey don't enter that age of reproduction. So if after you see your period, clean up, wash up, you are fine. But if you notice after your period, every time you dey get bumps from your period and you dey get pus inside it, then you need to see a doctor, make them find out why. Eh? That is it. You're not supposed to dey get pus bumps because of period. That one now maybe you're shaving. So I've given you the answer for the shaving. But if your menses, your period, they give you all those kind of things, pus, they come out and the rest, you go most definitely need to see your doctor. Hmm? Okay, let's take few questions as we prepare to round up. Um, let's take questions. I'm trying to go down. Before I take your question, share now. Share. Miss Cheesy says, answer me. Miss Cheesy, we know they see your, I not see your question, Miss Cheesy. Miss Cheesy Best, your question, I not see I define your question because you said, please answer me so that you won't say we ignored you. Okay. Please, what causes the foot, that is the leg, to peel off? What causes the foot or that is under the leg, right, to peel off? Seriously. Hmm.
Okay, some of
Okay.
them can be fungal infection. Yes, some of them can be fungal infection. Some can be because you dey put your leg for water. Some can be because of the shoe where you dey wear, or they always cover your leg with socks. You know, they let breeze enter your leg. So those can actually lead to that. And another could just promote fungal infection. And when you get that, it can actually have it. Also, some person can be having cracked foot due to the leg not dey moisturized very well. When we mean moisturize, when you don't bath, do everything, you clean the leg, you not rub cream, put very well. You can also be having those kind of cracked skin. The weather can also contribute to it. So if you dey notice all these things, and if you can't dey scratch you well, and all those peeling, you notice it the underfoot dey scratch you well, it can just be a fungal infection. You can see a doctor, a dermatologist, so that they can help you on that. So that e no go dey happen too much again. Most of the time,
Okay.
if you dey get am, you just carry the rub Vaseline put. Most of the time, e go stop.
You dey hear? Most of the time, e go stop. Okay. Share. If you have not shared, why? I will visit you. You dey ask me question, you know they share. I go visit you for your house. Oh yeah, now. Okay. Um. Good evening, doctors. Please, I noticed that if I take paracetamol injection, my urine will be very concentrated, even when I'm not dehydrated.
Okay, if you notice you take paracetamol injection, your urine dey always be like that. But if you take any other injection, e no dey be like that. For me, I think you should just leave paracetamol injection, and
Mhm.
there are other pain relieving injection you can take. And two, try and take a lot of, after taking the injection, try and take a lot of water and see if your urine will still be very concentrated. If your urine is not concentrated after taking a lot of water, it will mean that during that period you took the injection, you were not really taking a lot of water. When you say dehydrated, most of us are actually dehydrated. After you walk out from one place to another, they're already dehydrated. It may not all be showing like showing, no, but some of us are mild dehydrated, because when you go urinate, you see that the urine go turn not dey white. So in that means you're dehydrated. You need to just take a lot of water to so that the body system will get back to normal. So when you notice two things I've said. One, if you be say you take paracetamol, go and take a lot of water and check if your urine still dey concentrated. Then you do the second thing, you try and stop taking paracetamol and focus on any other thing, because you never can tell, if you may just have injury to your kidney.
Yes, so and most importantly, now who they give you this paracetamol
And
injection?
your liver.
Hope, hope say the person know about all this. Don't get one patient in the past where they react to paracetamol. The person cannot take paracetamol. This is why it's important as well that the people where they treat you, they also know about all this information and then follow the advice where Dr. Israel give you. So we are out of time. Let's take this last question here. This person be like saying a new follower, so make we just answer them. Get why I want answer. My friend have this ringworm around her, okay, her bum bum, and she was given a fungicide cream to apply. She did, and the ringworm disappeared. Then after a while, it came back again. My question is, what kind of test can she go and do so that she can really know the infection? Dr. Israel, please.
Dr. Fred, you don't want me to answer though. You can answer, She.
Oh yeah, make an answer. No verse. No verse. No verse. So I took this question deliberately for all the new people where just they follow us. We no go prescribe test for you here. We don't know you. We don't know your friend. We don't know anything about you. So we can't prescribe test for you. If we prescribe test for you, you can't go do the test and they give you results. So what next? You can't come back online again. You can't say, Dr. Fredo, I don't do the test. See the result. When we are not your doctors. So that is why we don't prescribe tests for people here. We don't even prescribe medications. Do you understand? We'll always beg you, if you get problems, speak with your doctor. If you want to have a private consultation, fine. You can book online for a private consultation. That one day different. You go pay. But we want you, most importantly, to see your own doctor so that may them check you. If you come here and start asking us which test and which test, I don't know you, I don't know how you look, I don't know which even day your bum bum. Whether now the thing is big like my head dead there. I've been a wound dead there. Huh? So that is why we always encourage you to please speak with your doctor, make them check you and then prescribe the right thing for you. But if you want a private consultation, you can book that one is separate. No vex. Okay, Israel. Any final words as we round up tonight?
Yeah. Okay. Before I say my final word, I want to say just two things. One, please, it not go make sense say we go the ask question for our friend. Like my friend is sick, which drug I'll give her? You not be your friend doctor, and not be your friend mouthpiece. If your friend know say the thing is really disturbing him or her, he go seek for medical advice. He go hospital as well. The only advice you can give to that your friend now, go hospital. And that's the best gift you can also give to that your friend. Or you follow and go the hospital. So don't we try not to help our friend they can't look for medication online, or because you really don't know the how the case really be to that your friend. Two, I remember some persons when we start, Dr. Fred said somebody asked about ovulation question again, how to calculate your ovulation. Please, I will advise say You just can't ask us the question, say, how to calculate your ovulation. It's like a broad thing. Remember, Dr. Fred already make video on it. If you watch the video, 1, 2, 3, you don't understand. Which parts you don't understand, and that part you go fit and ask us. You can actually write like, I've watched your video. I noticed you do this, but I don't understand how you got this. Then we cannot explain how that part is gotten. So not just saying we help you do everything all together. It's not going to easy for us. So it shows, if you do one like that, it shows say yes, you are following our pages and you dey listen to wetin we dey talk when you view our pages. And the last thing, my final word is to say, I dey always talk and I will keep on saying it. Abeg, make we take care of our mental health. You, when they listen to us, take care of your mental health. We, when they talk, we also want to take care of our mental health. Not be everything. Recently, now this one is quick talk. Not be everything person talk you go react to, because you never can tell wetin that person dey pass through when he talk wetin he talk. We've seen cases when person wake up in the morning, greet, good morning, they respond, and what is good about this morning? And you, when they tell what is good about this morning, you want respond, say, what is wrong with you? Me, because I greet you, I no greet you again. Before you know, fight don start. This is because of the stress when the country, in short, when the world at large. So let's try and take care of our mental health so that we'll be happy with ourselves. And thank you all for always being with us every Sunday by 8 p.m. to 9 p.m.
Thank you so much, Dr. Israel.
Dr. Fred.
Thank you. Yes, thank you very much. Thank you for watching. You will watch. You will share this live session. Thank you so much. You will just come. Sorry, next time come early. We dey start by 8 p.m. every Sunday. Now every Sunday we dey here. Next Sunday we will get a guest on the program, and the guest will be talking about nutrition, about food. So no miss am. We're gonna have a guest. If you come late, you don't miss. So come early by 8 p.m. and by 9 p.m. we'll be done. Thank you once again. Like I always tell you, good life now waiting. Good life. Now sense. Take care and have a wonderful evening. Au revoir. Bye bye.